The terminal branches of the vertebral and internal carotid arteries anastomose to form the cerebral arterial circle. The vertebral arteries join to form the basilar artery, which gives rise to the posterior cerebral arteries. The posterior cerebral arteries supply both the medial and lateral parts of the posterior cerebrum. The middle cerebral arteries arise from the internal carotid arteries. These arteries supply the lateral surface of the cerebral hemispheres. The anterior cerebral arteries also arise from the internal carotid arteries. These arteries supply the anteromedial portion of the cerebrum. The anterior cerebral arteries supply the anterior communicating artery, while the middle and posterior cerebral arteries supply the posterior communicating arteries. The cerebral arterial circle is supplied by both the anterior and posterior communicating arteries. Most of the arteries that supply the face and scalp are branches of the external carotid artery. The facial, superficial temporal, and maxillary arteries are the major branches of the external carotid artery that supply the face. The maxillary artery supplies the deep structures of the face, while the superficial temporal and facial arteries generally supply the superficial areas of the face. The facial artery further branches into the superior and inferior labial arteries as well as the lateral nasal artery. The facial artery terminates at the angular artery in the medial angle of the eye. The superficial temporal, occipital, and posterior auricular arteries, along with two branches of the internal carotid artery, the supraorbital and supratrochlear, provide blood supply to the scalp. Venous drainage of the superficial scalp follows the arteries. The supraorbital and supratrochlear veins unite at the medial angle of the eye to form the angular vein, which then drains to become the facial vein. The facial vein drains most of the face into the internal jugular vein. Venous anastomosis occurs at the medial angle of the eye, where the facial and superior ophthalmic veins meet and drain into the cavernous sinus.